Hey there, let's look at some past paper type questions. So if you're preparing for the neuro section of an exam, this is one of the topics that could possibly appear in some of the questions, and this topic will be traumatic brain injury and spinal cord trauma. So let's solve some high yield possible type of questions that could come out. Let's get right into it. Okay, question 1. So in the question 1, it says a 22-year-old motorcyclist sustains a severe head injury, and then they ask us which of the following is classified as a primary brain injury. And so you can pause the video and then try and get it yourself, and then once you unpause the video, the answer would be C. So why is the answer C? The answer is C because primary brain injuries happen at the exact moment of trauma. So these include diffuse axonal injury, cerebral contusions, and brain lacerations. Everything else listed is therefore a secondary brain injury. And as an exam tip, think for primary, present immediately. Okay, let's look at question 2. So for question 2, secondary brain injury, following trauma is commonly caused by, and then the answer would be B. So what's the answer B? The answer is B because secondary injury is preventable. And when the injured brain receives less oxygen, then what happens? When it receives less oxygen or reduced blood flow, neurons continue dying long after the initial impact. And this is why trauma management focuses heavily on maintaining oxygenation, blood pressure, cerebral perfusion. So remember, patients often don't die from the original injury. They deteriorate because of secondary brain injury. So that's an important thing to keep in mind. Now let's look at question 3. So question 3 says, which mechanism best explains diffuse axonal injury? And the correct answer here will be B. But why is the correct answer B? That's the important part. The correct answer is B because you need to keep in mind that this is one of the highest yield concepts in neurotrauma as part of neuro. So when the head suddenly rotates, different parts of the brain move at different speeds. So the long axons become stretched and torn. And patients often present with immediate coma, prolonged unconsciousness, and surprisingly normal CT scans. So a CT scan would be a computed tomography scan. And if you see high-speed accidents and prolonged unconsciousness and minimal CT findings, then you can think of diffuse axonal injury. Now let's look at question 4. So for question 4, a patient briefly loses consciousness, and then the patient wakes up, then deteriorates. And CT scans or CT findings show a lens-shaped hemorrhage. So what's the diagnosis? And then the diagnosis will be Epidural Haematoma, so E, and this is the famous lucid interval. So the patient hits their head, and then loses consciousness, and then seems perfectly fine, and after that there's rapid neurological deterioration. So that pattern should immediately make you think epidural haematoma. Let's look at question 5. For question 5, which vessel is ruptured from these? And the correct answer would be the middle meningeal artery. And why is that? And it's because this artery runs beneath the temporal bone. So a fracture tears the artery, which causes rapid arterial bleeding. And because it's arterial, the hematoma expands quickly. So think that you can think of it like this. Then when it's middle meningeal, you can think epidural. Okay, let us look at question 6. So for question 6, it asks which skull fracture is classically associated, and the answer would be the temporal bone fracture. And why is it? It's a simple association to memorize. So temporal bone, and then you can think middle meningeal artery, and then you can also think epidural haematoma. So those are 3 linked factors, or something like that could help you memorize it or remember it or go a long way. Okay, let's look at question 7. So for question 7, it says a 70-year-old patient on anticoagulants develops progressive confusion weeks after minor trauma. And then what will the correct answer be? So for the correct answer for this one, the correct answer will be chronic subdural haematoma. And why is that? The reason for that is because it's a classic type of patient scenario. It's an elderly patient. There's a minor fall and blood thinners are involved, and symptoms develop slowly. So this is because venous bleeding is much slower than arterial bleeding. And let's look at question 8. So for question 8, subdural hematomas result from rupture of, and the answer to that would be bridging veins. So the reason is because these veins stretch between the brain and dura, and in elderly patients, brain atrophy rather. So in elderly patients, brain atrophy stretches them even further. So small trauma is enough to tear them in cases like these. So remember, bridging veins equals subdural. Now let's look at question 9. So for question 9, we're looking at the computed tomography appearance, so the CT appearance. And the correct answer for this would be crescent-shaped collection of crossing sutures. So here's the easiest way to remember CT appearances, computed tomography appearances. So for epidural would be lens-shaped, for subdural would be crescent-shaped, and if that's all you remember from today's video, you'll probably get some multiple choice exam questions right, just from remembering that little pointer or tip, and hopefully it will go a long way. So let's look at question 10. So question 10 asks what contributes most directly to raised intracranial pressure from that. So the correct answer will be cerebral edema or edema, depending. I'm not sure what exact best way to pronounce it is. But the reason for the answer being that would be because swelling increases intracranial volume. And since the skull can't expand, pressure rises, and that raises the ICP. So the raised ICP reduces cerebral perfusion, and it eventually causes brain herniation. Now let's look at question 11. So for question 11, according to the Monro-Kellie Doctrine, the skull contains fixed volumes of, and the answer will be brain, blood, and CSF. And that's the correct answer, because if one increases, another must decrease, otherwise ICP rises. And this principle explains almost everything in neurotrauma. Now let's look at question 12. So for question 12, a patient develops one dilated pupil and worsening consciousness. So what's the diagnosis? So the diagnosis has got to be, in this case, the most correct answer will be brain herniation. And this usually represents uncal herniation compressing cranial nerve 3. So what's a clinical clue here? So a clinical clue will be one blown pupil, reduced consciousness, and medical emergency. And let's look at question 13. Question 13, which spinal cord syndrome affects the upper limbs more than lower limbs? And the correct answer will be central cord syndrome. And this is because it's usually caused by cervical hyperextension injuries. And that's because cervical fibers supplying the arms are affected more severely. So the upper limb weakness is greater, and this is a very ideal thing to remember. Now let's look at question 14. So most common cause of traumatic spinal cord injury, what will the correct answer be? The correct answer will be mechanical trauma, especially motor vehicle accidents. So you must always think that like road traffic collisions, falls, sports injuries, other forms of violent trauma for something like that. Now for question 15. Question 15 says spinal shock is characterized by, and the correct answer for this will be loss of reflexes below the lesion. And why is that? That's because immediately after injury, the spinal cord temporarily shuts down. So the patient develops flaccid paralysis, absent reflexes, and reduced muscle tone, and later the reflexes gradually return. Let's look at question 16. So question 16 is which arterial cord? So the arterial cord syndrome that primarily affects. So the question is arterial cord syndromes. To summarize the question, arterial cord syndrome primarily affects which tracts? So the correct answer will be the corticospinal and spinothalamic tracts. So the meaning of this is that patients lose motor function, pain sensation, and temperature cessation, but the dorsal columns remain intact. So vibration and basically vibration and I can't remember the other thing that's affected, but the something with a P. So okay, vibration is preserved, and proprioception, I think it is. So vibration and proprioception is preserved. Question 17. Question 17. So hemisection of the spinal cord produces, it will be Brown-Séquard Syndrome. And the reason for that is one half of the cord is damaged, and this creates a very characteristic neurological pattern. And now let's look at question 18. So which deficit is expected from that? So the deficit that's expected, it will be ipsilateral motor weakness below the lesion. And why is that? It's because ipsilateral is motor loss, proprioception loss, and contralateral will be pain and temperature loss, and this is one of the most commonly tested spinal cord syndromes. Let's look at question 19, the second last question. So secondary spinal cord injury includes, and the correct answer will be ischemia, inflammation, edema, and these processes continue damaging neurons even after the initial trauma, and you must always look for common types of patterns. So in this case, you can notice that the same pattern has the same or similar pattern as traumatic brain injury. So primary injury happens first, and then secondary injury comes after that. Now let's look at the final question. So for the final question, it says complete spinal cord transection causes. Transection causes, and the correct answer will be loss of both motor and sensory function below the lesion. And the reason for that is because this represents complete interruption of ascending and descending pathways, and unfortunately neurological recovery is extremely limited. Thank you so much for watching this video, and please like it if you liked it. Then more people can like it and can help as many people as possible. Then they can help more people, and we all can help people, because that's the purpose of literally studying medicine, to help people. So I hope it helped you, and also if you want to, you can subscribe, and that will be very helpful. Bye.